Soda City Live, everyone. Pelvic health is not a widely discussed topic because for many it's truly a private matter, but putting off treatment because you feel uncomfortable talking about it can do more harm than good. Today we're going to talk about how you can get the care you need and at least open your mind to some options. Joining us today on Soda City Live is pelvic health therapist Paige Butts, and she's here to share a little bit about what she does and the types of options that she offers. Paige, thank you so much for joining me today.
Yes, thank you for having me.
So when it comes to therapy for your pelvic, explain to us how you will even go about knowing if you need that or not.
Yes, and so a big majority of the people that we treat in pelvic floor physical therapy are those that have any kind of urinary or bowel dysfunction. So you're thinking things like urinary leakage, coughing, laughing, sneezing, urinary urgency or frequency, trying to get to the bathroom in time, trying to go often, any kind of bowel dysfunction, so constipation, difficulty having bowel movements, pelvic pain, whether it be something that's been going on for a long time or something that's newer, pain with intercourse, interstitial cystitis, or some people notice painful bladder syndrome, those kind of things. And we often see hip pain, back pain, postpartum patients, patients that are pregnant, the back pain, the hip pain, the pelvic pain that comes with that as well.
Yeah, and so when you treat your clients, this is a specialized treatment that you do outside of being trained for your typical physical therapy treatment. So explain to us how that works.
So I do have my doctorate in physical therapy, and outside of that I had to do specialized training for pelvic floor physical therapy. This is very much a specialized aspect, and you do have to have extra training outside of that. So I did extra coursework, I had mentorship to get specific training in pelvic floor physical therapy.
Can you explain to us the type of clients or patients that you see? Are these people more in the sports world, or are these your everyday?
It is a combination of everything.
Yeah.
So outside of the pediatric population, I'm treating from age 18 to 75, 80-year-old women. And so it's really just a very broad range. Could be sports related, could be pregnancy related, could just be things that have been going on for a really long time and they're finally seeking help. So it's really a broad spectrum.
What are some of the misconceptions about pelvic therapy?
Oh, goodness, the misconception. So a lot of people just don't really talk about it. It's something that they kind of feel embarrassed about, or they don't want to bring it up. If the doctor's not specifically asking them the questions, they're not going to talk about it. And I think right now there's a big push in our world to really start talking about these things and these subjects. And so I think now people are being more open to it and more open to receiving the treatment. I think a lot of people think it is just like a typical orthopedic outpatient physical therapy where you're just going to kind of go and do some, of your typical orthopedic type stuff. But with this being such a specialized treatment, there's really so much more to it than what people know about.
And before we wrap up, we have some pictures of the actual therapy sessions that you've been able to lead. I'm going to pull those pictures up. Explain to us, what are some of the exercises that one will go through when it comes to pelvic therapy?
So, a good portion of the treatment is external work, but we also do a lot of internal work as well to really get to the pelvic floor and find out what's going on at the pelvic floor level. The best way to do that is through internal treatment. But externally as well, we're going to work on the muscles, the soft tissue, the connective tissue that attaches to the pelvis, making sure that we're really getting a well-rounded treatment approach. And so that's going to be different mobility exercises, stretches. I'll do some like cupping, if people have heard of cupping, dry needling, manipulations, those kind of things. And then internal treatment is depending on what's going on, really assessing the muscles. Do we need to strengthen the pelvic floor? Do we need to lengthen and relax the pelvic floor, depending on what the patient has going on?
All right, Paige Butts, thank you so much for coming on
the show. Thank you so much.
How can people stay connected with you?
Yes, absolutely. So my website is empowerpelvicwellness.com. And my email address is at the bottom of that. It's paige@empowerpelvicwellness.com. And then there's a box at the bottom of the website where they can inquire about a consultation.
All right, great information.
Yes, thank you so much.
Well, still to come on Soda City Live, we're going to tell you about a way you can celebrate Black History Month right here in the city of Columbia. Stay tuned for more details about the Heritage Park.